Hey friends, welcome. So today we're going to do a simple explanation of hypertension. So if you've been told you have hypertension or something called pre-hypertension is what you get right before you get hypertension, this could be a useful video to you to kind of start building your understanding of what's going on and why is it important to you, because you may not understand or you might need a second explanation or further details. So this is going to be a quick few-minute video just going through that and kind of giving you a basic level of knowledge so you can improve your health. So first thing I want to point out is that hypertension doesn't happen in a healthy person. So if you do have hypertension, you have a disease and you need to treat it as such because it can become very serious. So hypertension is a disease. Don't say, oh, I kind of have hypertension. No, you have hypertension. That's okay because thankfully we live in a world where we know a lot about it. So a basic explanation I like to use is a bag and a balloon analogy. So for example, say if you have a bag, like a plastic grocery bag, and you pour a gallon of water in there, right? What's going to happen is that bag is going to expand, it's going to reach its limits, and it's going to stop expanding. And so I think a lot of people think our blood in our bodies kind of work like that. We're just a bag of blood and we carry it around. But it's not true. The way blood works in our body is more like filling a balloon. And what happens is you fill the balloon with water, and what's going to happen is there's going to be a certain pressure pushing the water out of the bag. And that's your blood pressure. So what happens is, say if there's too much water in the balloon, it's going to increase the pressure and there's going to be more force. Or if there is an external pressure pushing the balloon in, it's going to create more force. Or say if you used a really old balloon and the balloon is kind of like maybe a little hard, it's not very stretchy, what's going to happen is the bag is not going to be able to adjust and accommodate more volume. And if you put a second gallon of water in a balloon, what's going to happen is the balloon's not going to be able to expand anymore. It's just going to become rigid. It might even burst. That was kind of a little bit of a hurried explanation or abbreviated explanation of what hypertension is in layman's terms. Now, going back to like a practical explanation, essential hypertension is when you get hypertension from your basic habits and your health and your genetics. There's no set cause. Like for example, I can't say because you have diabetes that caused hypertension. No. If you have essential hypertension, which most people, they would be considered essential hypertension, no known real cause, then they have a constellation. So like say for example, you have poor eating habits, you don't work out, you live a very stressful life, and you have heart disease in your family. That's enough to set you up really well to get hypertension. Now, there are secondary forms of hypertension. When I mean secondary, caused by something. So here's a quick list of things because I think you should read it so that you know that these things have to be ruled out. So if somebody tells you you have hypertension, they also have to make sure that you don't have sleep apnea, kidney disease, adrenal gland tumors, thyroid problems, which is very common, congenital disease from birth, or maybe your prescription meds are out of balance. Maybe you're taking some illegal meds. Cocaine can cause hypertension along with a few others. So make sure you rule those things out before you say, hey, you have essential hypertension, which is just general hypertension. Now, there are certain things called risk factors. Now, risk factors are things in your control, or maybe not in your control, that give you a better chance or a lesser chance to have hypertension. So these risk factors, I'm not going to talk about them in detail. I'm going to leave a link to the Mayo Clinic. They have a great webpage where they explain all the risk factors in detail, and they kind of give you simple explanations and different ones. But what I'm talking about is like smoking, diabetes, inactivity, family history, a lot of the things I mentioned before. Now, complications. So complications This is something. This is a conversation you should sit down and have with your physician, because complications can be different for different people. But at the end of the day, what you have to realize is 1/3 of the United States population has hypertension, and only half of those people that have hypertension are managing it correctly. Um, and in the United States, it's actually pretty crazy. So, the hypertension epidemic in the United States costs the United States $48.6 billion each year. So, think about what happens if we all kind of manage our hypertension a little bit better. It can kind of make a big difference in our economy even. So, what you want to hear, and what a lot of people want to know about when dealing with hypertension is like, okay, so I have hypertension. What do I do now? So first things first, you want to sit down and talk to your doctor. And if you have hypertension, you want to make sure that you're seeing that doctor regularly. What that means, once every 6 months, once every year, that's up to you. But hypertension is a very dangerous disease. It can cause stroke and heart disease, which is the leading killer in America. So you have a disease that is the leading killer in America. You can't go without seeing a doctor. You need to see your doctor, and your doctor will most likely prescribe medicines. And these medicines you more than likely will take for the rest of your life. Like I said, you have a disease, but there's a lot of things you can do to affect it. Your eating habits, your lifestyle, your stress, these risk factors that are modifiable, and that's kind of the word doctors use, modifiable. They can give you your health back. And in certain cases, if you follow them strictly enough, you can completely reverse the effects of hypertension, and you can come into something what I like to call subclinical hypertension, where say you have a diagnosis, someone's told you have hypertension, but you don't meet the criteria anymore because you change your lifestyle habits. You start eating healthier, more greens, more vegetables, less meat, less high cholesterol foods, less oils, less fats. Hey, instead of working out maybe once a month, I'm working out 3-4 days a week, 5 days a week. My cholesterol has come down, and my blood pressure is no longer in the range where my doctor thinks I have hypertension. Now, you still had hypertension. The damage caused by hypertension is still there. But since your body is now reaping the benefits of better health, it's able to compensate better. So you won't get hopefully you won't get the side effect, the complications of heart disease and stroke, which are, anybody who's seen that happen, or had a family member or known somebody that had a stroke or a heart attack, you know how serious it can be, and it is a pretty serious thing, and it's something we can change, and you can have your health back, you can have your life back. So that's basically my explanation of everything. I hope that it helps you. Let me know if you have any extra questions. I'll try to answer them. And I'm going to leave the links in below for the information I was talking about. You can go to the Mayo Clinic. There's another link which has the stats I was talking about, so you can look at the stats and really know what's going on. The more you know, the better you're going to be prepared to move forward with your life. And I hope you have a great day. Like, comment, subscribe. I think people say that, right? So good luck.